Good day, everyone. My name is Grace Ogala. I bring you good news from Amazing Grace Health Center. The topic of our discussion today is helpful tips to decrease the risk of kidney disease. This is a very important topic because kidney disease is the ninth leading cause of death in the United States. This may sound surprising to you, but it's true. Kidney disease is very common. And that is why we will discuss this topic and find out ways to decrease our risk of getting kidney disease. Okay? Healthy kidneys perform powerful and important tasks in the body, such as releasing hormones to regulate our blood pressure, balancing the fluids in our body, production of urine, and filtration of waste in the body. However, unhealthy kidneys cannot carry out these vital functions. Chronic kidney disease is a condition in which the kidneys are damaged and cannot filter blood as well as they should. Because of this, excess fluid and waste from blood remain in the body and may cause health problems. All right? If the kidneys cannot filter the waste, the toxins in the body, or take away the excess fluid in the body, there's definitely problem in the body. There's going to be lots of health problems. You will find out that the person can even have edema. Sometimes you see swollen legs, sometimes high potassium, and even heart attack can even happen. Stroke, heart failure. There's just so much package with damaged kidney. It's not a good thing at all, okay? And it can even lead to death. And also it can make people to end up having dialysis, okay? So pay close attention because this is a very important topic like I mentioned earlier, okay? The risk factors of kidney disease are diabetes, high blood pressure, heart disease, and family history of kidney failure. It is often diagnosed with a blood test or a urine test, okay? The doctor can just order a blood test called CMP, and the doctor will check for your creatinine, your GFRO in this blood test. And it is recommended that men should have the creatinine level of 0.6 to 1.2 milligram per DL, and women should have creatinine of 0.5 to 1.1 milligram per DL, okay? If it is above this level, maybe when your blood test result come and the creatinine is above, the doctor may advise a referral to the nephrologist if it continues repeatedly, that is not a very good thing though. And also if the GFRO is less than 60, all right, it may signify kidney disease as well, okay? So the doctor will put so many puzzles together, the creatinine, the GFRO, and also the urine sample will be also used to diagnose you for kidney disease because if there's protein in the urine sample, it may signify kidney damage, okay? And also if you have symptoms such as lower back pain, recurrent urinary tract infections, uncontrolled blood pressure, uncontrolled blood sugar, and abdominal pain and flank pain, these are all not very good symptoms, and with the elevated creatinine and the low GFRO, the doctor will have no choice but to send that person to see the nephrologist. And if the doctor refers you to the nephrologist, don't feel bad because it's actually a good thing that whatever problem that the individual had was discovered early because a stitch in time saves now, okay? The nephrologist will evaluate and treat the condition in a timely manner. So let's go further and discuss the helpful tips to decrease the risk of kidney disease. All right. The very first thing that we need to do to decrease our risk of kidney disease is keeping blood sugar within normal limits. Okay. It is recommended that we should have a blood sugar of 80 to 130 before meals. And blood sugar should be less than 180 2 hours after meals. And A1C should be less than 7. This is very, very important because over time, high blood sugar can cause blood vessels inside the kidneys to become narrow and clogged and can cause damage to the blood vessels and harm the kidneys. This is not a good thing if, God forbid, this happen, okay? And so just keep your blood sugar within normal limits by doing the needful, taking your diabetes medicine, exercising, maintaining a healthy weight, good dental care, stress management, all the things we've been talking about. Just do everything like advised and follow up with your doctor regularly. And I'm sure you'll be able to control your blood sugar adequately. And don't forget to eat well, because if you eat well, your blood sugar will not be all over the place. You don't have spikes of blood sugar. All right. And the next point here is the blood pressure. Your blood pressure should be less than 130/80. Okay. If you find that your blood pressure is so high, please let your doctor know. Your doctor can prescribe medications like losartan, lisinopril, benazepril to protect your kidneys. Okay. And also, there are some cholesterol medications that can be prescribed for you, such as statin, simvastatin, atorvastatin, can be prescribed for you if you have elevated cholesterol. Okay. It is recommended that people with diabetes should have LDL of less than 70 if they have risk factor of cardiovascular risk factors such as hypertension. And if that person really have the cardiovascular problems, the LDL, the bad cholesterol, should be less than 55. The triglycerides should be less than 150. The total cholesterol should be less than 200. And HDL, that's the good cholesterol. It's recommended that men should have HDL above 45, and women should have the HDL above 55. Okay, this is so important because you need that your cholesterol should be within normal limits, because it can also damage the blood vessels. Okay, and that's not good for your kidneys at all if the blood vessels are destroyed. Okay, and also you should maintain very healthy weight. Make sure your BMI is less than 25. That's the body mass index is less than 25. All right. Lose weight through exercise, eating healthy, do the best. And if you need weight loss medication, your doctor can prescribe it for you as well. All right. And also sleep adequately, about 7 to 8 hours each night, and have adequate stress management. You can use stress management techniques such as yoga, massage, meditation, gardening, praying, talking with a good friend, people that encourage you. It's very important. Listening to messages of hope is also good. And also eating healthy is very, very important. Have a healthy diet plan such as the Mediterranean diet, the DASH diet. These eating plans include fresh fruits and vegetables, fat-free or low-fat milk, and also whole grains, fish, chicken, turkey, beans, seeds, nuts, all right, and low sodium content, and low fat content, and lean meat. Okay, lean. If you need to eat meat, eat lean meat, lean chicken, not fat dripping all over it. All right, and you can use the plate method. The plate method of half of it is fruits and vegetable, 1/4 is protein, and the remaining quarter is low carbohydrate whole grains. That's also helpful and easy to follow. All right. And when you eat salt, make sure it's less than 2,300 milligram daily, and that's less than 1 teaspoon. All right. I really want you to eat very small content of salt. Don't eat a whole lot. Don't do those salt shakers. You know what I'm saying. And also avoid canned food. It's better you eat fresh fruits, please. Take your medications as advised. Okay. American Diabetic Association advise medications such as Jardiance, which is good. It's protective of the kidney, and it's a good blood sugar medicine. Like that's a good diabetic medicine. So your doctor know what to do, and your doctor will prescribe such medication for you, especially if you have a kidney disease. Okay, and also there is a medication that is called finerenone. That's a very good medication that can be prescribed for you as well. All right. When you have kidney problem, your doctor is brilliant and will do the right thing to preserve your kidneys. Okay. And make sure you take all the medications that are prescribed for you. Do not skip any dose. Okay. And also go to doctor's appointment as advised, so your doctor can monitor your kidney functions very closely. Also, if you have signs of urinary tract infection, let your doctor know. Such symptoms of urinary tract infection is increased frequency of urine urgency, foul smelling urine. You can even have back pain. Just make sure, don't hide anything from your doctor, because a stitch in time saves life. And if, God forbid, you have urinary tract infection, your doctor will prescribe you antibiotics, okay, and treat you in a timely manner. Also, be very careful about the over-the-counter medications like ibuprofen, Advil, naproxen. Such medications not good for the kidney. Okay, before you take medications, always check with the doctor so your doctor can advise you appropriately. And stop smoking if you smoke. That's not good for you. Okay, smoking, like I said before, is like setting your body on fire. That's not good. Smoking destroys blood vessels and organs of the body. And don't drink alcohol, please. Alcohol raises blood pressure. It's not the best for you. The following tips are good for making healthy choices. When you cook, please cook with mix of spices instead of salt. Choose veggie toppings such as spinach, broccoli, and peppers for your pizza. Try baking or broiling meat, chicken, and fish instead of frying. Avoid fried food, breaded cheese, breaded dish. No, that's not good for you. Serve foods without gravy or added fats. Try to choose foods with little or no sugar. It's preferred that you drink the 2% milk or the skim milk, which is the fat-free milk, and preferably eat whole grains like whole wheat bread, brown rice, oats, bread. Okay, just substitute the brown rice for the white rice. Substitute the oat bread for the white bread. Very important. And read your labels very carefully. Okay. Slow down with snacking. Well, if you must snack on healthy fruits like apple is a healthy snack. Eating avocado is good. I love eating avocado. My coworkers will tell you about that. It's my favorite snack. All right. Avoid eating things like potato chips. Potato chips is loaded with salt. That's not good for you. Okay. And let's quickly discuss 20 healthy foods for fighting kidney disease as advised by the Cleveland Urology. Okay. The first fruits that is very important to us is cranberry. I'm sure you all know that this is going to be my first pick. Cranberry help to keep the urinary tract free from infection. Okay, so when you drink cranberry, your risk of having urinary tract infection is decreased. Okay, it's so good. You can eat the fruits. The fruit can be sour sometimes. You can just add it to salad, though. You can add it to smoothie. All right. I like it. It's delicious, though. All right. Also, you can drink cranberry juice. But if you must drink cranberry juice, please dilute it with a lot of water. Okay. If you can get the sugar-free cranberry juice, please go for it. Okay, and red grape is very good. It reduces inflammation and help protect against diabetes. Okay, you know the red grape has a lot of chromium in it, but I will say eat the grapes wisely. Don't go and fill up the plate with grapes and say it's me that told you to be eating lots of grape. Please, everything you do should be done wisely. Like 15 grape is enough. That's 15 grams of carbohydrate. All right, everything in moderation. Apple is very good. It has a lot of fiber in it. It will reduce your cholesterol, prevents constipation. Pineapple is also good. It's low in sodium and potassium, but be very careful when you eat pineapple because it's a sweet fruit. It can raise your blood sugar. Do everything in moderation. Just take a few slices of it, not a whole lot. And you can mix it with things like blueberry, strawberry, all right? So that way it will not cause spikes in your blood sugar. Blueberry is good, strawberry is good, raspberry is good, blackberry is good. Cauliflower is very good. It has a lot of antioxidants, a good source of fiber. Okay, olive oil is very good for cooking. Garlic is very good, and the bell peppers, all those your green pepper, red pepper, very good as well. Cabbage is very good. The skinless chicken is good. It's less in potassium and sodium. The angula green leafy vegetable is also good. It is low in potassium and it's good for your kidneys, okay? And it will help to lower your blood pressure as well. And also don't forget to drink water because water will help the kidney to filter out the toxins from the body, okay? Water is very essential to the body, okay? You can drink water about half of your body weight. Like if you weigh 200 pounds, you should drink at least 100 ounces of water, which puts you in about 16 ounces of water. So 6 bottles of 16 ounces of water. You know, like that water bottle, drink about 6. 2 in the morning, 2 in the afternoon, 2 in the evening is great, okay? Also, onions is very good. Macadamia nuts is very good if you have it in your country. It's delicious though. And fatty fish such as salmon, tuna is great. The egg white is very good. And the sheets take mushroom is very good. Radishes are very good. And also turnips are very good. All right. And you should be creative, all right? This is what I have for us today, all right? I pray that God will heal us from every kidney disease. And I pray that Almighty God will help us that we will not have kidney disease. And those people that already have it, God will heal them. People that are having dialysis, God will heal them. God will provide kidneys for them in Jesus' name. Just do the needful, please, okay? We have talked a lot today, and I know that a word is enough for the wise. Eat healthy, exercise regularly, at least 30 minutes a day, manage your blood sugar appropriately, and also stress management is very important. Sleep adequately, good dental care. Don't forget to check your feet. Make sure you have healthy feet. And if you are sick, let your doctor know. Your doctor can prescribe the right medication for you. Don't forget follow-up appointments. All right. And don't forget to follow me on all social media outlets. Thank you for listening to me. I really appreciate you so much. God bless you. And until we meet again, it's goodbye for now. Bye-bye.